So welcome. Thank you for joining us today. We like to start our webinars off wishing everyone good health. We hope you and your families are staying safe during this time. We appreciate that you've taken the time to be with us today, so thanks for attending. This is the fourth webinar in our 5-part series. We have one more next week where we're going to focus on the conditions of certification and surveillance. Today we're going to deep dive into the new criteria specific to the 21st Century Cures final rule. There's a link here to register, and it will also be on our website on our resources pages. We're going to also start a weekly blog post to break down the 21st Century Cures as it pertains to the 2015 edition testing and certification program. You can sign up for those emails via this link here, and I'll drop it in the chat box in just a moment so you have both links. We are recording today, and we're going to send that recording out via email later this week. We'll also post it to our website. So I'm your host, Melissa Martin. I have several panelists on today. First, Timothy Bennett, our test lab director who runs our test lab. He, along with some of the others at Drummond, meet with ONC weekly for clarifications on the rule, as well as discussing the future of the program. We have two of our account managers and test proctors on as well, James Threet and Heather Kelty. James is going to be our main presenter today. He's worked in the healthcare industry for the past 17 years and provides a lot of that test support for our developers. And answering the questions live during the webinar today, I have Heather Kelty. She has 14 years experience in IT and healthcare. She's also one of our account managers and test proctors. She'll be answering the questions while James is presenting today. So at the bottom of your screen, you'll see a Q&A box where you'll be able to submit questions. Heather's either going to get to those live, or we're going to have James or Timothy answer those at the end. And for any questions that aren't answered during the event today, we'll get back to you via email, so please submit as many questions as you need. We're also going to take a couple of poll questions during the webinar that's going to help better support our developers and give our test lab some much needed information. So we ask that there's some participation there. I'll let Timothy talk about that in just a moment. Again, this is being recorded. We know there's a lot of information to take in, so we are recording today, and we'll send that out at the end of the week. So with all of that, let's get started. And Timothy, I'm going to hand it off to you.
Yeah, thanks, Melissa. And let me just echo, you're welcome to all of our clients and customers and, other folks that have joined us today. Thanks for taking your time out and listening in. And certainly we covered your questions, just like last week, when we went over the revised criteria that's in the rule. This week, we're going to be going over the new criteria that's in the final rule. And your questions and your participation in our polls really, really will help us, understand, where everyone is with their understanding of the rule, and just to help us, serve you better, as you begin your own journey to becoming, Cures rule compliant. I'm going to present just a couple of slides here. If you were on last week's webinar with the revised criteria, this is going to be a little bit of a review, but I just wanted to go over this again, just in case we have some new folks joining that wasn't here last week. So just bear with me for just a few minutes before I hand off to James for a deep dive into the new criteria that's in the Cures final rule. A question that just comes up is who does the Cures rule apply to? And just want to make it very clear that the new and as well as the revised criteria that's in the Cures final rule, it applies to all certified 2015 edition certified products. We kind of touched on that last week. At the very least, everyone has to implement the D12 and D13 criteria. That's required for all certifications moving forward to be Cures compliant. And so, even if you happen to have a EHR technology that where that might not implement all of the criteria, might not implement the ones that have changed, or you even need to implement the new criteria, you'll still have to, at the very least, certify those two privacy security criteria. James is going to go over that in just a little bit more depth in a few moments. But everyone is going to have to move to being Cures update compliant. Over the next, mostly within the next 2 years. So we'll get into the details on that. But obviously, if you don't have a 2015 edition certified product at the moment, that's still something you're thinking about, or you're still sort of in process. Just know that these additions here will supersede the current 2015 certification, and so you don't have to do one and then do the other. You can just go straight to being, Cures compliant. So that's just to make sure everyone understands that. James, if you will, go to the next slide. So one of the things that James is going to talk a lot about in his discussions on the new criteria is going to be talk about a lot of dates on the timeline of when you need to be compliant to certain things. And I just wanted to sort of set this as a precursor to that so that we have to keep repeating it. But, ONC did provide some flexibility due to the COVID-19 pandemic in terms of, compliance to the timelines that's set forth in the Cures rule, by giving, everyone generally an extra 3 months of compliance window, for all of the, timelines specified. They didn't move the timelines, so, the, deadlines are still the deadlines. So the deadline to have your real world testing plan this December 15th submitted to your ACB and uploaded to the chapel, that still applies. But the flexibility here is you're just given an extra 3 months in leeway in order to actually do that before you're in a non-compliant situation with the ACB. So deadlines didn't move, but you have just a little bit of flex time to take advantage of if you need it. And this really applies to all of the deadlines, and if some of the deadlines are recurring, like they're annual or semi-annual or whatever, it really just applies to the first one. But a lot of these deadlines are just one time only, and so of course it would apply to that. So as James talks about dates and deadlines, just understand that everywhere he's talking about that, there's the plus 3 month window for compliance on that. All right, next slide, please. Another couple of just brief overview things here. The publication date of the final rule was May 1st. That's when it was finally published on the Federal Register. That sort of starts the clock ticking of all of the references in the final rule. The first thing that's referenced in the final rule is the effective date of the rule, which is 60 days after publication date. So that lands on June 30th. So I just wanted to throw those dates out because they're key dates that was sort of generically put in the final rule. But now that, it's been published, we have hard dates for it. And so we just wanted to make sure everyone understands that. So when folks talk about the publication date, now they're talking about May 1st. If folks talk about the effective date of the rule, that's June 30th. And so another thing to kind of, understand here is that for the first 24 months of the effective date of the rule, there's really going to be two versions of the certifications that's going to be active with ONC. There's the existing 2015 editions that many of you already have, and you have chapel listings for those. But everyone is going to be trying to move and get that 2015 edition Cures update certification. So in the interim time, there's going to be a mix of these two different types of chapel listings on the chapel, and there'll be ways to, see the difference on the chapel and filter and whatnot. But just understand that, you are, while there's not a new program, it's still part of the 2015 edition. It's part of you continuing to be compliant to the 2015 edition of ONC's program. There is a new distinction of the rule, in this interim time, just to support being able to move from one to the other. The only exception to this will be the B10 EHI export criteria, which is given a 36-month window to implement, test, and certify and be compliant to. James will go over that as well. And then, so generally the way that will work is within 24 months, you'll move to a cures update status. Then you'll have an extra year for to implement the B10 criteria to maintain your new 2015 cures update certificate. So hopefully that's clear to everyone. And of course, if it's not, just make sure you ask questions, and we'll address it again, later at the end when we have time for questions. All right. I think that might be it. James, you want to go to the next slide? I think it's time to hand it off to James. Yeah. So let me introduce my colleague, James Threet. He is one of the Test Proctor's account managers here at the Drummond Group Test Lab. Many of you have already started working with him as your test proctor, so you may already know him. You may already have had some interactions with him, and I just welcome him here to do the deep dive into the new criteria that's in the cures update. So James, have at it.
Thank you, Timothy. So in discussing the new criteria, just having discussed those deadlines and the timelines that have been modified by the enforcement discretion, let's talk about timelines for these new criteria. So the important milestones are listed here, starting with June 30th. And so the enforcement discretion doesn't change the actual deadline that's specified here. So all of these dates are written into the law and are not going to be changed. The enforcement is what's going to be changed. And so you'll have 3 months after this for enforcement and compliance. So I'm going to use the official deadlines, and then, but keep in the back of your mind that there is that 3-month kind of flexibility in terms of compliance. So starting with June 30th, this is the effective date of the rule, and this is when you can begin to test and certify the new criteria, D10, D12, D13, and G10. Next is December 15th, 2020, which is when the real-world testing plan must be uploaded to Chapel. It will be aligned with certified interoperability criteria, including B10 and G10, when you have them certified. We will be disseminating a deadline for when those real-world testing plans must be submitted to Drummond. We expect it to be sometime in early November to give us time to review and post them to the Chapel. And also note that December 15th is a recurring deadline every year. So real-world testing plan every year must be posted to Chapel by December 15th. April 30th, 2021 is going to be the first maintenance of certification attestation deadline. There is a 30-day window. It'll be open from April 1st to April 30th, but it must be completed by April 30th. And this is a recurring deadline every 6 months. So April and October of every year recurring. Next is March 15th of 2022, and this will be the first date that real-world testing reports and results are due. This will affect the new criteria that I'll discuss today, because the interoperability criteria includes B10 and G10 if you have them certified. And this will also be a recurring deadline every year. Reports and results are due to be published to Chapel March 15th. Next is May 1st of 2022. This is the deadline to have the new criteria certified. D12, D13, and G10. Also note, if you were present for our webinar last week, there was a typo on the slide. The deadline for the revised V3 and C3 is also May 1st, 2022. The only new criteria that is not due in 2022 is B10, EHI Export. And that's because there's some additional sophistication there, and ONC wants to give developers additional time to meet those requirements. So let's talk about these criteria in detail. The new criteria are here, and let's go into that. So the first one is D12, Encrypt Authentication Credentials. This can include password encryption or cryptographic hashing. The standard for this has been adopted in FIPS publication 140-2. Those of you who are already certified to D7 and D9 are already familiar with this document. FIPS 140-2 security requirements for cryptographic modules. This D12 Encrypt Authentication Credentials does apply to all new and updated certifications after June 30th, 2020. But it's just a simple yes or no attestation. No is an acceptable response. But by attesting yes, you're saying that authentication credentials that are stored are protected consistent with the encryption requirements. Next is D13, multi-factor authentication. It's commonly referred to as something people know, something people have, and something people are. So something people know is a password, something people have is an ID card or a USB security device, and something people are is a fingerprint or a retinal scan. This has been around a long time. I happened to catch the original Mission Impossible movie from 1996 on TV the other night. And if you remember seeing that movie, there was a scene where they are trying to break into a vault that has some super secret computer. And the only access to that vault was with a password, an ID card, and a retinal scan. So this has been around a long time. It's been in the movies even. So in this case, it's going to apply to all new and updated certifications after June 30th, 2020. It's also a simple yes or no attestation. No is an acceptable response. But if you say yes, you must describe the use cases that are supported. Next, let's talk about B10 EHI Export, which is part of the Care Coordination B criteria.
Hey, James.
Yeah.
Before we jump into this, let's get that first poll question out here.
Oh, right.
And have everyone answer that. All right. Thanks.
Okay. Which of these new criteria is your organization most ready to test and certify? B10 and G10? All right, so diving in, B10 EHI Export. Many of you will notice that B6 Data Export is being replaced by B10 EHI Export. B6 compared to B10, B6 required date time filtering and recurring schedule exports. It required CCDA release 2.1 and required CCDS, or Common Clinical Data Set. B10 EHI Export changes that because there's no date time filtering required. The recurring exports are no longer required. There's no specific data format, and it expands the data beyond the Common Clinical Data Set to USCDI plus. B6 Data Export confirmed two things: that EHRs were not info blocking, and it also gave users a way to export patients out of the system with CCDA formatted XML documents. B10 is also going to serve two purposes: the single patient record request and the all patient record export for transfer to another EHR. So yes, you heard that right. ONC wants EHR developers to build in functionality for their users to transfer their data out to another EHR. B10 EHI Export also has an info blocking component with conditions of certification, maintenance of certification. So that will also be covered later. But unlike B6, B10 has those separated, the info blocking from the actual act of exporting. So what is the definition of EHI? So all four of these are written into the CURE's final rule. And so let's discuss them. EPHI, which is electronic protected health information, in a designated record set under HIPAA. So that means that EHI is anything a patient can request under the HIPAA privacy rule. The CURE's rule also specifies all records the health IT system produces and electronically manages. And health IT developers should already know what EHI their product contains to support HIPAA right of access. So examples of EHI, and the CURE's rule does reference 45 CFR 164.501, which gives the following examples: medical records, billing and payment records, insurance information, lab test results, medical imaging, and any other records used to make decisions about individuals, whether or not those records have been used to make a decision. Explicitly excluded from EHI is psychotherapy notes and info compiled for a legal proceeding or administrative action. So the expected output is going to be all data stored at the time of B10 certification. That means that if you build an interface after you certify B10, that data is not included in what must be exported until it's certified. Connected health IT systems that store EHI are in scope, even the uncertified ones. So as an example, PACS, so picture archiving and communication systems, also known as image management. If an EHR stores a link but not the whole image, you must include the link. If you have the image, you have to include the image. Now, the formats can be in any electronic and computable format that developers choose. So the medium for sharing that export is not specified either. So you can set up a secure FTP, or you can snail mail floppy disks. Either one, it's up to you. You must write your own documentation and keep it up to date. This documentation must explain the formats used, including the structure and syntax, and that documentation must be publicly accessible, so it cannot be behind a login. Caveats to B10. Products not certified to B10 by May 1st, 2023 will risk non-compliance and losing their 2015 edition CURES update certification. USCDI is not required for EHI export. However, data elements from USCDI are the minimum necessary to satisfy EHI export. So once more, it's not USCDI certification that's required, but the data elements that compose USCDI that need to be allowed for. So problems, allergies, medications, and so on must be available in the EHI export. There is a conditions of certification and maintenance of certification component to B10. It must be included in a real-world testing after it is certified. And the test procedure is not yet available. We expect it in early June. Looks like we have a poll question. Please take a moment to answer this. All right, next up, application programming interfaces for interoperability. G10. The official name is Standardized API for Patient and Population Services. G10 is being added to the base EHR definition, and it is designed to provide known technical requirements so third-party apps can be developed. It is limited to read services and two specific types: single patient data and multiple patient data. Multiple patient data is referred to as population services, and examples of that are accessing records of patients with a certain disease, a certain insurance, authorized representatives, so a parent that needs access to their children's records that must be accessible through the API, as well as providers with multiple patients in common. So a general practitioner who refers 10 patients to a specialist, that specialist should have access to those patients' records via the API. G8 is the former API criterion that is effectively being replaced by G10. And as comparison, G8 did not specify a standard. It only focused on CCDS data elements. There was no standard for how that CCDS needed to be represented. There were few security requirements, and it only supported a single patient use case. The G10 API criterion requires FHIR release 4. It has USCDI data elements. That USCDI is as implemented by FHIR resources. So how FHIR implements USCDI is how that must be represented. There are many security requirements and two use cases: the single patient record request and the population record request. This is a list of the implementation guides that are relevant to G10. There are 5 different implementation guides. These links will be available in the slides after this talk. You can also get links to these from the G10 draft test method, which is currently posted to healthit.gov. And we're going to be using the Inferno test tool to test this API. Inferno has sample test data, but it's not required to be used in testing. So those of us very familiar with Alice Newman, Jeremy Bates, Rebecca Larson, and John Wright, we no longer need to worry about them. G10 test procedure. Security aspects of the procedure include application registration. So apps need to be able to register with your authorization server. It requires a secure connection, TLS 1.2 or better. Token introspection, so the functional requirement for the authorization server to validate tokens that it has issued. Moving on, authentication and authorization. There are patient and user scopes for this and system scopes. And these are detailed in the implementation guides. The other one is patient authorization revocation. So patients need a way to be able to revoke access to their medical records through the API at any time. The actual functions that the API needs to support are search and data response. So search includes capabilities and provenance, and the bulk implementation guide includes capabilities and group export operations. The data response for single patients is detailed in the implementation guides, and multiple patients adds the bulk implementation guide on top of that. Lastly, testing G10 requires documentation. So if you're familiar with G7, G8, and G9, those criteria require documentation to be publicly accessible. And this is pretty much the same thing here. So documentation that explains registration, configurations, syntax, parameters, errors and exception handling, this is going to be very much the same thing. And I think we have a poll question. All right, moving on to the actual Inferno test procedure. Inferno provides demanding testing with thousands of HTTP requests and numerous scenarios, sequences, and tests. It will also make allowance for visual inspection and attestation on requirements that it cannot test. These are some of the things that Inferno cannot test. Things that are in green may require visual inspection. Things that are in black are not in the normal testing flow. However, Inferno will make an allowance for this in the test procedure, and these things will need to be completed by the test proctor in order to complete the testing on the API. This is the homepage for inferno.healthit.gov. You'll notice there are two editions here. The one we are going to be using for certification testing is the ONC Program Edition. Community Edition is for other use cases and for your own testing. So Inferno Sandbox is available on the Inferno site. However, MITRE recommends a local installation for when you do your testing. It is a container-based installation, and it's recommended to use Docker, which will package all the required components. Inferno is open source and published on GitHub. So using Ruby, Java, and so on, and you can grab the source code and look through it yourself if you like. This is an example test report from Inferno. So you'll see here that it gives a pass-fail result. This example shows that 1,700 requests were made and numerous references and resources, and the version showing is 0.9.6. The actual test version that we're going to use is going to be Inferno version 1. We expect that to be released in June. The test report also gives a list of all of the separate required tests and their results. So you can scroll down quite a bit from this report and see lots of the tests that have been completed. So let's talk about applicable standards. USCDI is one of these that we've talked about a lot. We talked about it last week in the revised criteria webinar as well. USCDI stands for United States Core Data for Interoperability. This is an expansion on the previously required Common Clinical Data Set. It revises the allergies and intolerances section and adds provenance or author, pediatric vital signs, clinical notes, address, phone, and email. Note that the address, phone, and email are being added to give additional data that you can use to deduplicate and merge records that you've received. USCDI version 1 is the adopted standard, and a link to it is provided. There is not a whole lot of information there. We are expecting this to be released in June as well, and that will give a lot more instruction over how the provenance on the clinical notes needs to be implemented. We did receive a lot of questions about those, and when we receive more info from ONC next month, we will be able to answer those questions. Now, USCDI, as it relates to B10 and G10, USCDI data elements are required for any export starting November 2nd, 2020. And that is under the info blocking content and manner. So those data elements, but not certification of USCDI, are required starting this November for any data request and export. Now, for G10, USCDI data and metadata as implemented by Fire Resources. So you may notice it's somewhat different than how USCDI is represented. For B10, EHI Export, USCDI is also not required, but the data elements are required. So you do need to make allowance for those data elements. If you're already certified to CCDS, you'll only need to complete an attestation for USCDI. However, you'll need to prove compliance with USCDI through real-world testing going forward after you certify. In the meantime, you can use CCDS for real-world testing until you do have USCDI certified. And finally, USCDI will be updated under SVAP. So let's talk about SVAP. Standards Version Advancement Process. So for all reference standards, ONC has decided to build in a way for them to update standards without needing to make a new rule and get it published. This is going to apply to code sets like VOINC, RxNorm, SNOMED, as well as USCDI and FHIR. What this means is this is going to save ONC from having to go through the effort and the extended time periods involved in making new rules. And so this just lets ONC approve a new version, and then vendors can update to those new versions. It does require, when you do the update, that you give advance notice to your customers and to your ACV. These new versions must be mentioned in your mandatory disclosures. These mandatory disclosures are also changing and will be covered somewhat in your semi-annual attestation, April and October of each year. Finally, if you update these reference standards before August 31st in any given year, those new versions of the reference standards must be included in your real-world testing plan due December 15th and tested the following year. So next we have the pediatric testing and certification. And I'm going to bring Timothy back to talk about this.
Yeah, thanks, James. So yeah, you can go on to the next slide. We did, because this is new in the cures rule, we did want to spend a little bit of time talking about the section 6 in the final rule, which is the voluntary pediatrics testing and certification language that ONC included in this final rule. But let me take you back, and just so everyone has a common background, to the actual congressional act, the Cures Act that was passed. In the Cures Act, there was a few things that Congress instructed HHS and ONC to do. One is, or the first thing was, to encourage the voluntary certification of health IT for specialty practices, specialty, medical specialties and whatnot. And then they further went on to specifically talk about the pediatric specialties and, instructed the Secretary of HHS to make a stakeholder-informed recommendations for the voluntary certification of, health IT for pediatric settings and providers. Specifically, obviously, with the, the purpose of supporting, better health care for children. They went on to further instruct ONC to adopt certification criteria in support of voluntary certification of pediatric EHR technology. So let's move on to the next slide, James. And let's talk a little bit about what ONC's response to those congressional mandates were and how they chose to implement them in the Cures Final Rule. So if you go to Section 6 of the Cures Final Rule and read it, you'll get the whole, the whole download from ONC on their pediatric certification program. Although that's a loose term that I'm using there. But the way ONC responded is they did make 10 recommendations that EHR technology should contain in these deployed pediatrics settings. And they were informed by, they convened a large stakeholder community, which consisted of pediatric clinicians and other healthcare industry experts. And so these 10 recommendations were kind of the most important ones that sort of bubbled up. And most of these recommendations are tied back to requirements that came out in AAP's children's EHR format a few years ago. They then aligned these recommendations to their existing and perhaps the new criteria that's part of the Cures rule, but they chose not to create any new pediatric specific criteria. In other words, they just took the 10 recommendations and they broadly said that existing certification criteria can be applied to these pediatrics settings without doing anything specifically pediatric with those criteria. They further decided not to create like a specific certification track for pediatrics apart for or in addition to or corollary to their 2015 edition certification program. They chose not to incorporate any kind of distinguishing mark on the chapel listings that would identify some EHR technology as meeting these 10 recommended pediatric functions. So in essence, the recommendations are just there for EHR developers, health IT developers to incorporate on their own voluntarily, and that's pretty much the extent of it. Go ahead into the next slide, and we'll kind of follow up with that in just a moment. But I want to take a moment here just to flash up on the screen what those 10 recommendations are. I'm not going to go through these. I'm not going to talk in detail about them. You can look at them, and then when you get the slides, you can study them a little bit more. You go to Section 6 in the final rule to see what they say about each one of these. There is a link in the final rule, or at least a reference to the children's EHR format recommendation that they're based on. And, that document is kind of publicly available as well. Anyway, let's go on to the next slide. So kind of coming out of this, Drummond Group has decided that, we are going to develop and launch our own Drummond branded pediatric testing and certification program. First of all, it'll be based on ONC's 10 recommended pediatric recommendations. So, we are aligned with those recommendations, but we do intend to extend the pediatric functionality requirements beyond just those 10 recommendations. We ourselves convene an advisory panel, that consisting of many pediatric clinicians and industry stakeholders. Some EHR vendors are here to represent, and from other, pediatric organizations in the industry, many of which are the exact same people or persons that were influential in lobbying Congress to have pediatrics included in the Cures Act to begin with, and also served as voices to ONC as they were, coming up with what the 10 recommendations are. The idea is that the 10 are really important, but there's also a lot of things that were not included in the cures rule with pediatrics that are also important too. And so other things in the children's EHR format, recommendations, things like Bright Futures, if you're familiar with that, and other requirements that are out there. And so we have an advisory panel that is informing Drummond Group of what that might look like, and we also have EHR vendors bringing their own feedback to it as well. We do, while the program is not yet fully developed and launched yet, we do anticipate that there will be multiple tiers of compliance that will kind of be part of our program, starting out with some of the minimum basic requirements to get a pediatric certification. That would certainly include the ONC 10, but could include more than that. But then there would be some more advanced and robust requirements that would indicate a fuller, more robust implementation of pediatric functionality. We anticipate that there will probably be an inpatient track and a different one for ambulatory, because pediatrics in those two settings are very different. One is well child care, the other would be newborn and newborn ICU and things like that. So the purpose here is we've gotten some feedback from some of the vendor community, EHR community that's interested in pediatrics, and they really are looking for some way to distinguish themselves as meeting pediatric core functionality or even advanced functionality, and have something that distinguishes that for them in the marketplace. And with ONC not really going down that road, there was a gap there, and so that's where we're kind of coming in, and we're on track to develop and launch that voluntary Drummond branded testing and certification program probably at the beginning of the year. I think that's after the first of the year we're thinking we'll be ready to begin that. So let me bring up a poll question here, and this is the final thing I'll kind of say with our prepared comments, and then we'll kind of get into some questions. But just just survey you guys and just see how many of you might be interested in learning more about this pediatric testing and certification program that we're working on at the moment. So just give you guys a moment to answer that, and then we'll kind of wrap up and get into Q&A. All right, James, you want to move on? And I'll just say we'll just flash up some final resources and reminders of everyone. We're going to try to get to all the questions that you guys have submitted today. We have some that we've pulled out. We're going to answer live. Some of you folks, we've been answering the questions live during this. We've gotten some really great questions that we're going to have to follow up with some of you, offline. We're going to have to go check with ONC or kind of do a little bit of studying on our own, because you guys, as always, ask great questions. So just be patient with us as we, get the correct answers for you. We may not get to answering all the questions today, and if we don't, then we will definitely follow up with you personally. We'll have your email address, and we'll answer your question if you didn't get it answered here personally. And then we also will be compiling all of the questions and answers from all of our webinar series. And so at the end of our webinar series, we're going to kind of push out, a comprehensive Q&A document to everyone. So I just wanted to let everyone know kind of where we were on the whole question and answer thing. Don't forget that we have one more webinar coming up next week. My colleague Sonia Galvan will be talking about the impacts of certification next Tuesday with the Cures Update rules. So let me now jump over here to my colleague Heather Kelty, who's been furiously manning the Q&A panel Heather, you got some questions that you want to kind of throw at James and I to answer?
I do have a couple good questions, several good questions here. So let's start with, there's quite a few repeat questions, so I think it's good to touch on a couple of these things. So one of the questions is, when you have a fully integrated PM EHR system, there could be billing information like claims, patient statements, you know, things outside of a patient chart. If all that data comprises EHI, how do we know where to draw the line on what's required as that part of the export? And there were several other questions kind of around what needs to be part of that. And I know we kind of touched on that, so I thought we could follow up with that.
Yeah, James, you want to take that, or you want me to start out? I mean, it's either way.
Yeah, so the final rule makes this a very vague but very broad list of things that are expected. Now, I shared your concerns that there's a lot of information that you may not have access to or control over. And so in that regard, we are waiting for ONC to publish the B10 test procedure, and we should get more information through that. So the things that I covered today are, straight out of the final rule. We cannot tell you exactly what that's going to be until they've made the test procedure and given us an indication of how we expect to test and verify that you are exporting everything that needs to be exported.
Yeah, I mean, just to provide a little color to that, this is one big question that we obviously have as well of ONC is, what is that sort of comprehensive list of things that is included in EHI? I will just suspect that, just based historically on how ONC operates, they won't provide, a comprehensive list and then that's it. It'll be more, guardrails and guidelines and, parameters around it. And we will all have to sort of, navigate that and sort of ask for clarification. So I really anticipate that the answer to this question being something that evolves a little bit over time. I think ONC probably at this point would view that in their hierarchy of priorities of educating people on a little bit lower down the totem pole, because everyone has 3 years to do it, and they've given, that's the longest reach of compliance. So we may have to wait a little bit before we all kind of fully understand that. Certainly, when the B10 test procedure comes out, hopefully that will shed a lot more light, as James was saying, on that. But I would imagine that even then there's going to be questions going back to clarify, and it's going to be something that ONC will sort of work on and evolve, over a period of time. And, we all like to have all the answers tied up in a neat bow, you guys, us as well. But, that's the nature of the process here that we often find ourselves in. And I suspect that will be the case here. But, understand that's something that we are actively, trying to find out. And as soon as we, know that, we will, communicate that out. And certainly as you begin to work with your test proctor here, on your own journey towards Cures Update, that'll be the prime way that you can, get the answers to that questions as it evolves. All right, what else do you have for us?
Yeah, absolutely. So there are several questions surrounding when USCDI is going to be required for the EHI export and the timing with what's needed to be provided for that 11/2/2020 date and then the 24 months out. So I thought we could clarify a little around that limited and full EHI definition.
Yeah.
James, I know we've talked a lot about this. You want to go ahead and
Yeah, so It is pretty confusing. So let's break it out into different components here. So November 2nd, 2020 is when under information blocking, any data export that's requested must include all the components of USCDI. So the listed elements like problems, medications, clinical notes, name, email, address, phone number, those all must be included in an export starting November 2nd, 2020. That does not mean you need to certify USCDI. It just means that you need a way to be able to export them starting November 2nd in response to a request for data.
Yeah, and let me just clarify something, though. I do think, though, James, that I think for that November 2nd deadline, I don't think that you'll be required to do the new USCDI, the 4 new USCDI data elements, the pediatric data, the provenance, the address, phone number, email address, that sort of thing. And what was the 4th one? I never can remember.
Vital signs.
Yeah, well, there was another one. Anyway, the 4 new ones, I think really the things that you just have by that first deadline, what we're understanding is you just have to make available the things that are in the CCDS, which, overlap with USCDI, but I think you have time before you have to support the new USCDI data until you actually test and certify the USCDI criteria. I believe that's right.
Right, and B6 data export does support that CCDS.
That's right. That's
so
right.
We already have that.
That's right.
And then what we're talking about for November is also only in response to a request for data. So it's not something you proactively need to do. It's only something you need to think about in terms of responding to a request for data. Okay.
Yeah, and then just to close that up, the full EHI compliance has a 3-year window before you have to support that.
Right. And that also doesn't require USCDI, just the components of USCDI.
Right.
As well. So USCDI is referred to as an update over CCDS, and it applies to previously certified criteria that had CCDS. So B1, B2, E1, G9, those previously certified with CCDS, and those will need to be updated with USCDI.
Yep.
And that has to be done by May 1st, 2022.
Yep. All right, maybe you have time for one more question, perhaps.
Yeah, there is a question in here because we're throwing out deadlines for the vendor to be certified. Are there deadlines for when the vendor's customers have to be on the new certified with all the new updated Cures Act criteria?
So that's more something related to MIPS PI program and CMS programs. It's really outside the scope of certification, what your customers are doing. And so for that, we would suggest that you inquire about that at qpp.cms.gov. You can call their customer service line, and they have what I had experienced was pretty good customer service, and they would create a ticket and follow up with you. And you can rely on their interpretations. But what your customers are doing really is outside the scope of certification. So we do get that question a lot.
Yeah, I'll just echo James. I think most of that's going to be a CMS requirement for providers to have. Although I will reserve, maybe we see if Sonia might address this in next week's certification webinar. There could be some I'm not as familiar with all of the attestations that you have to make. There may be, you know, some requirements in that to have some of this functionality, you know, rolled out, you know, at a certain time to your customers. But, you know, we're kind of out of time now, but, you know, come back next week for our certification webinar. And, you know, we might find out if there are some, you know, conditions of maintaining your certification that is tied to, you know, rolling out this functionality to your clients.
And
Let's all,
so
yeah, I'll
thanks
just hand it back to
everyone.
you.
Yeah.
Yeah.
Yeah, I was just going to let everyone know again, we're going to send out the recording at the end of the week. So you'll all get the recording and a link to the download the slides if you would like. And then we'll get back to these questions that weren't answered during the webinar as quickly as possible. So thank you again, everyone. And sorry we ran over a little bit, but really appreciate everyone's participation. And thank you. And hopefully we'll see you again next week for the certification webinar with Sonia. Thanks again.